Hello and welcome back. This is Dr. Puyo from Gainesville Complete Dental. This is our third video. We talked about cavity, we talked about how we find them, and my goal is today to show you how we start treating those with dental fillings and talk a little about dental fillings that we have. And that would be it. Next week we try to talk about something more exciting, okay? Okay, let's do it. Okay, let's do this. Before I start showing you how we do the fillings, I just want to talk briefly about dental filling materials. There are a lot of products out there, but there are two big ones. One of them are silver fillings or amalgam, and the other one is white or color toothed. Some people call it bonding, or we call it composite. We don't have any silver filling in this office. We are metal free, so I don't have any to show you. But they are metal alloys, and because of having mercury in their substance, many countries even they don't use it anymore in general. In US, based on American Dental Association, they're currently safe to be used, but many of my co-workers, including me, we don't believe in them because of there's no bonding between those material and the tooth, and long term we see some cracks happening on this teeth that was treated with amalgam. The second one, as we talked, is the color toothed or white. The material, we call it composite. They're resin based. We get the cavity out. I'm going to show you in a second. We put them in. There is a bonding agent that we use to bond this composite to the tooth, and then we have a curing light, which is a blue light that causes the reaction to start. So the material is kind of soft when we put inside of the tooth, and by curing with the blue light, we make them hard to stay there. This is the same tooth that we talked last time. You remember our cavity here. I'm gonna show you how we get the cavity out using our burr or drills. Gonna be a little noisy. Please be patient with me for a second, and then I'm gonna fill it up with dental material. Alright, let's do this. Bring my suction tube. With it. So those places that we assumed that there was a cavity, so I used my drill, I went through it. The reason we use a lot of water because that drill makes cause some heat. We use the water to cool down the tooth and make sure your tooth is safe when we do it. So we did a couple of holes here. We got those cavitated or damaged tooth tissue out. I assume there was one between the teeth as we talked on our first video, and now we're gonna fill them up. So since we don't want to connect the tooth to each other, we use there are different ways of doing this. I use this, it makes it faster. We put something between the teeth to separate them, to make sure your teeth are not connected to each other. And that's the poking teeth that we use to separate even more, to have a good connection. We want this teeth kind of connect to each other or touch each other, but not bond to each other. So that's why we make the virtual wall. Now we have the bonding agent. Just go, and this is a plastic, we don't technically need this, but just to show you the process that we do for your filling, we use a bonding, then make sure it's dry. As I said, we have a blue light, gonna use it, I'm gonna cover. done. Then we put our white or color to that or composite in. Reshape it, get the excesses out. And again, cure. Okay, then we remove everything. Okay, so it's filled. We have to polish it. Don't have my polishing kit here, but you can see what we did. Then we use that articulating paper, and we ask you to just tap, tap, tap. So basically, by doing that, we see this places that you bite on this tooth, and if it's something like higher than something that should be normal, we get it out. I hope you enjoyed this video too. I try to just briefly show you what we are doing when we're inside and do your fillings, both between the teeth and on top of it. As I said, I try to find a better subject and more exciting subject for next week, but that would be it. Okay, enjoy and see you next week. Bye.